So, up next, we have Dr. Ye Tuyen, who will be sharing effective strategies for preventing and treating acne scarring.
Good evening, everyone. First of all, I would like to thank you, Biodharma, for having me in this webinar. I'm Dr. Ye Tuyen, and today my topic is acne scarring, prevention and treatment in 2025. There is no conflict of interest in my presentation. Let me start with the overview of acne. Acne affects about 9% of world population. It is common in 80% of teenagers and 30% of adult women. Acne is the 8th most common disease around the world. You know that acne can cause anxiety, depression, low self-esteem, and even increase the risk of suicidal thoughts. So you can imagine if you have permanent acne scar, it can have bigger psychological impact. Actually, intensity and size of the scar doesn't matter. Even you have a very tiny scar on your face, it has impact on your emotion. Why do we need to treat acne? The reason is early acne treatment can prevent scarring. In the top chart, you can see that the longer the acne and treated, the higher the chance of scarring. You also can see that after 1 year, scarring increased a lot. In the lower chart, it shows that the severity of the acne increased the risk of scarring. For my acne, 28% could develop scar, but for moderate to severe acne, 50 to 70% will get scarring. Can we predict who are at the risk of scarring? There are things we can predict, like people who have inflammatory acne, people who are not treated properly, people who like to pick, squeeze, or pop their acne, people who have family history of acne scarring, and male patients are found to be having more scarring than female. This is the classification of acne scar and treatment modality. Acne scar can be classified into pigmentary changes and contour irregularity. Hypertrophic scar account for 20% of contour irregularity and atrophic scar for 80%. Within atrophic scar, we have ice pick, pop scar, and rolling scar. Current treatment methods are chemical peeling, substitution, CO2, laser resurfacing, microneedle RF, collagen biostimulator, and azosol. In 2023 and 24, everyone talk about microneedle RF and acne scar. But in 2025, I think people are more interested in biostimulator and azosol. How to approach acne scar? We all know that the management of acne scar is sometimes very challenging to us. There is no single treatment which is the best for all scar type. Different scar type respond to specific treatment. That's why I wonder, what if we combine with treatment modality? It could smooth acne scar more effectively, or it could heal faster, or it could tackle tricky conditions. The question is how to combine them. So we can go for tailored approach according to different types of acne scar, or we can go for layered approach. For example, we can start with the substitution to cut the scar adhesion from the bottom, and we can do injection of biostimulator for deeper scar and skin firming, followed by laser resurfacing or chemical peeling for superficial scar, and then finally we can apply PLP or azosol for wound healing enhancement. Let me start with the chemical peeling, which is very safe procedure. It gives the best risk-benefit ratio of all scar type treatment. It can be used for BIH as well as BIE. My approach is basically I start with salicylic acid or glycolic acid. Sometimes I combine. It is only for acne. If there is a BIH, I usually do TCA peeling. If there is an ISP scar, we all know that they are very difficult to treat. So for those, we need to do focal TCA cross, and I prefer to use 100% TCA. This is my patient with 100% TCA cross. You can see the endpoint, which is frosting and surrounding erythema. This is a case of BIH, BIE, and enlarged pore. For this case, I did salicylate and TCA peeling for BIH, and I did TCA cross for pore enlargement. This is another case of atrophic scar and BIH. For this case, I did CO2 fractionating laser combined with azozone for her atrophic scar, and I did chemical peeling for her BIH. Subcision. Subcision is the most important technique for atrophic scar. Basically, subcision is a short form of subcutaneous incisional surgery. We can use simple hypodermic needle or no-gauge needle. For me, I prefer to use hypodermic needle, which is easily available in the market. We can also use cannula, especially if there are rolling scars. The technique is we are trying to break the scar adhesion by two different motions, forward and backward motion and side-to-side motion to lift the scar tissue. There are a few side effects which are not very serious, like erythema, edema, bruising, and tenderness. This is the case of Popscar scar. In this case, I used 22G hypodermic needle for subcision. I did forward and backward motion, and I did side-to-side motion in order to get the scar adhesion. You can hear the snapping sound when the fibrous bands are broken. This is a case of rolling scar. For this case, I used 22G blank cannula for subcision. You can see that I did injection of biostimulator at the same time with the subcision. You might notice that my cannula was in the subdermal plane, and I used the method of retrograde linear threading method. I tried to stop injecting 1 centimeter before the entry point in order to avoid the accumulation of the product at that area. This is another case of rolling scar, but in this case, she has quite thick skin, so I used 21G blank cannula instead of using 22G. It was like previous case. I did injection of biostimulator at the same time with the subcision. But for this case, I used retrograde fanning technique for biostimulator injection.